Okay, so let's continue on by looking at the coronary circulation. And as I mentioned before, the heart I like to describe as being selfish. And I say this about the brain as well when we talk about neuro. But the brain and the heart, they are self-preserving, rightfully so, right? They're very important vital organs. But the heart, the way that it does this is that it takes blood immediately from the aorta by way of the right and left coronary arteries, which we reviewed, are branching immediately above the leaflets of the aortic valve. So here's the aortic valve, here's the pulmonary valve, the superior vena cava for reference, and then the pulmonary artery here. So we're looking at an anterior view of the heart. So here's the sternocostal surface for reference. Here's our right auricle. Here is our left auricle. Here is our left ventricle. Right? We said that this one is right ventricle. And then here is our aorta. So immediately from the aorta, we have the right coronary artery coming off, looping around the right auricle. And then we have the left coronary artery coming off and immediately dividing into two smaller branches. So let's talk about the right branches first. The right branch, right coronary artery, is going to wrap around the right side of the heart, and it's going to give off blood supply to the right structures. The right auricle, it's going to give off the right ventricle blood supply. And then if we look at a posterior view, here's our posterior view. So this is the right side, and this will now become the left side. So notice that the right coronary artery wraps all the way around the base of the right atrium, and then it's going to branch and continue supplying the back side of the right part of the heart. Okay, so that's our right coronary artery. The left coronary artery is going to be a little bit more interesting. It comes off, moves to the left side of the heart, and it immediately divides into two important branches. It's going to give off the left anterior descending. This vessel has also more recently been renamed, or we've changed the name of this vessel to the anterior interventricular branch. And that is descending along the septum. So if we remind ourselves that this is the left ventricle, this is the right ventricle, this is the interventricular septum, and that is a part of the area that the anterior interventricular artery supplies. The second major branch is the circumflex branch, and that kind of dips, as you can see, kind of hides underneath the left auricle here, and then it's going to move to the back of the left side of the heart and give supply to the left ventricle and parts of the left atria. And as we can see here on the posterior view, it's going to continue branching to supply the back of the left ventricle, back of the left atria, and then merge with branches of the right side. So what's happening is the right is coming off, moving right. The left is coming off, dividing into two. Anterior interventricular is supplying the anterior part of the septum, and then left circumflex is moving around the back to merge with branches of the right coronary and continue supplying the back of the heart. Right. The third important vessel that's worthwhile to discuss is the coronary sinus. So here's that coronary sinus, and this is picking up all the venous drainage, excuse me. The venous drainage that's coming from our different coronary veins. We have the small coronary vein, the great, and then the middle coronary vein, and they're all going to drain into the coronary sinus. That is going to wrap around the base of the left atrium, and then as we saw earlier, that is going to open into the right atrium, and that is how that deoxygenated blood coming back from the tissue of the heart can be dumped into the right atrium and can be reoxygenated through the cardiac circulation. All right, so the three vessels that are important to describe here, the right coronary artery, which we said is coming off here, supplying the right side of the heart, the left coronary artery, and that is going to further divide into left circumflex and left anterior descending or anterior interventricular. And thirdly, the coronary sinus, okay? So let's say 5 important vessels, right? If you consider those two branches, 5 important vessels regarding the coronary supply to the heart. Let's describe some of the other major vessels in the area. So some of what we call the great vessels. These are some of the largest vessels in the body. The aorta, for example, is one of our large elastic arteries, and these vessels accommodate a lot of blood flow. The superior vena cava, we know, is receiving blood, poorly oxygenated blood that is coming back from the subclavian veins, which drain the upper extremity, from the jugular vein, which drains the head and neck, and then those are going to merge together to form the brachiocephalic vein, right? So it's a small connection which is merging the supply from the jugular and the subclavian, and then both brachiocephalic veins will merge together to form the superior vena cava. It's important to note here that the left brachiocephalic vein is longer just because it has to cross the midline in order to meet the right brachiocephalic, and then together they form the superior vena cava. So superior vena cava is bringing back all of the blood, so all of the poorly oxygenated blood from both upper extremities and from the head, the neck, and including the brain drainage as well. Let's speak about the aorta and its branches. So the aorta is that main artery that's leaving the left ventricle. It's starting off with the ascending aorta, which is a very short piece that is directly coming from the heart. Then it becomes the arching aorta. So the arch of the aorta, the portion of this vessel that arches over the heart and runs on the posterior aspect of the mediastinum. The arch of the aorta gives off three main branches. It gives off the brachiocephalic trunk. So it's really important, whereas we had the right and left brachiocephalic veins, for the artery, there's only one brachiocephalic structure. It's the brachiocephalic trunk, and it is only found on the right. From the brachiocephalic trunk, then we have two other branches, the right subclavian artery and the right common carotid artery. The right subclavian artery supplies the right upper extremity, and the right common carotid artery supplies the head and neck and brain. Then the other two branches coming off of the arch of the aorta is the left common carotid artery. That is a direct branch from the middle of the arch of the aorta. And then the left subclavian artery is the third and final branch that's coming from the end of the arch of the aorta. The left subclavian supplies the left upper extremity, and the left common carotid supplies the left head and neck and brain. So the disparity that we see here is that the right side receives flow from this brachiocephalic trunk, whereas the left side receives flow from immediate branches that are coming directly from the arch of the aorta. From there, the aorta descends along the thoracic cavity. This portion is referred to as the thoracic aorta or the descending aorta. It then gives off blood supply to several structures in the thoracic cavity. It gives off the intercostal arteries that we talked about last week that supply the rib spaces. It gives off blood supply to the esophagus, blood supply to the trachea, etc. And then it pierces the diaphragm, and it becomes the abdominal aorta and supplies structures in the abdomen and then pelvis. Okay. We're visiting here the pulmonary vessels. So we began looking at the division of the pulmonary trunk. So here's our pulmonary trunk. It gives off right and left pulmonary arteries. And then we have 4 pulmonary veins. So coming back from the lungs, we have the superior right pulmonary vein, superior left pulmonary vein, and then inferior right pulmonary vein and inferior left pulmonary vein. So there are 2 pulmonary arteries and 4 pulmonary veins. The veins are going to be draining oxygenated blood back into the left atrium. Okay. And then here's just a nice view of the pulmonary vasculature, showing them with the heart intact, right? Showing them with the lungs, heart, trachea, and aorta intact. So here we can see that large pulmonary trunk, giving off its two major branches going right and left almost immediately. And then if we notice, we can also see the lighter pink colored structures being the four pulmonary veins that are returning to the left atrium. So here's the left atrium at the posterior aspect of the base of the heart, and this is where that fresh oxygenated blood is going to first arrive and then move through the left side of the heart and then move through the aorta. Lastly, the inferior vena cava is a very important vessel. It's receiving blood from the majority of our circulation. So the abdomen, pelvis, this includes the entire gastrointestinal tract, as well as the lower extremities. So all of that blood flows through the inferior vena cava and enters the right atrium to be circulated and reoxygenated. Let's look at some of the nerves in the thoracic cavity and talk about their location and their function. So the two important nerves that we encounter are the vagus nerve, and this is our cranial nerve number 10. So there is the right vagus nerve, which is this structure here. And this is running very close to the midline. The left vagus nerve descending very close to the midline in the thoracic cavity. And then it's going to give off several branches, including the left recurrent laryngeal nerve. So notice that is a branch coming off the vagus, wrapping around the arch of aorta. This is where that name comes from, recurrent. It's going to descend, wrap around the aorta, and then it's going to ascend here again. So here's that branch going back up to supply the larynx. And so the recurrent laryngeal nerves are what give innervation to the laryngeal muscles. And so the common clinical connection that we see to this nerve is hoarseness of voice. So sometimes we have patients that have gone in for some type of thoracic procedure. Maybe they've had an open heart procedure. Maybe they've had a vascular procedure in the carotid artery or something of that nature. And then after they wake up from their procedure, they're hoarse in their voice. And that is because inadvertently or by accident, the recurrent laryngeal nerve has been injured. And so the innervation to the larynx is interrupted. And so this patient wakes up with no voice. So that's a really important connection to knowing the route and the function of the vagus nerve and the laryngeal branch. On the right side, there is no arch of aorta on the right. So the structure around which the right recurrent laryngeal nerve wraps is the subclavian artery. So here's the right subclavian artery. Here's our right vagus. Here's that right recurrent laryngeal branch coming off, wrapping around the subclavian, and then going back up to innervate the larynx. And then here's the rest of that vagus going down. The vagus is going to innervate a lot of structures on its way down to the abdomen. It's innervating the heart, the lungs. It's going to innervate parts of the stomach, the lower parts of the esophagus, and then it's going to go all the way down and innervate some of the gastrointestinal organs. So the vagus nerve is the longest cranial nerve. It goes from the brainstem all the way through to the GI, and it's probably one of the busiest cranial nerves in that it innervates several structures on its descent towards the abdomen. Lastly, the phrenic nerve. So the phrenic nerve is another important nerve in the thoracic cavity that we have to watch out for if there are any internal or thoracic procedures. The phrenic nerve runs on the outside of the thoracic cavity. So not on the middle of the mediastinum. It's going to run on the outside aspects and then eventually the outside of the pericardial sac. It actually innervates the pericardial sac, and it also innervates the diaphragm. So that is another important connection. If there is injury to the phrenic nerve, these patients are going to wake up with difficulty breathing. So because hopefully it's not bilateral. If it is bilateral, that's going to be fatal, right? If it's unilateral, which is the most common case, that patient is going to have difficulty breathing, and that's going to be the first indicator the phrenic nerve has been injured